My name is Igilige Ijeoma. I'm an optometrist practicing here in Nigeria, and I'm doing my fellowship in Low Vision Rehabilitation, Indian Academy of Optometry. I'm here to do my clinical practical on low vision evaluation. Now, what is low vision? A person is said to have low vision if the vision in the better seeing eye is less than 618, even after treatment or refractive correction, and that the field of vision is reduced to 10 degrees from a fixation point. What are we going to do today? Today, we're going to preclinically evaluate a low vision patient. We're going to assess the need of this patient. We're going to do a low vision evaluation and rehabilitation, and finally dispense a low vision device depending on what the patient needs. How are we going to do this clinical assessment? We're going to start by observation. As the patient walks in, we're going to observe how the patient walks in, his gait, his posture, movement, and then see if he's used to the environment, how he reacts to the light, and all that. We're going to take a history based on task. We're going to take the person's visual acuity, distant and near visual acuity. We're going to refract. First of all, we'll start with the objective refraction retinoscopy, and then we'll conclude with the subjective refraction. We finally are going to evaluate the patient's visual functions, contrast sensitivity, color vision. We're going to do an Amsler grid test, and then we're going to calculate the distant and near devices depending on what this patient actually needs, select the one device the patient needs, and then we're going to train and rehabilitate this patient. So welcome. What's your name? How old are you? So if we bring something at close, are you able to read? If you bring, even if it's tiny, were you able to read it? Not really. Depending on the if it's too tiny, even if you bring it close, it's not clear. And you want to read, you want to be able to carry out your duties at work very well. You want to be able to read, you want to be able to work on your system, right? Okay. Okay, so we've been able to take her history and then her family history, health history, medical history, and all that. So we're going to take her visual acuity at far using our Snelling charts, after which we'll also take her visual acuity with the EDTRS charts. So we're going to start with her visual acuity. Okay, so let's take it from the first line. I've closed your left eye, so you're reading with the right eye now. Fine. Eight. We're going to take the distant visual acuity using the EDT-ROS logma charts. So we're going to take the right eye, the left eye, and then the both eyes. Okay, so we've closed the right eye. So we're going to do with the two eyes now. Okay. So let's take it again. Those- Mhm. Which other one can you see? Mm-hmm. Mm-hmm. O S. So we're going to do the functional assessment now, the contrast sensitivity, which is going to do 1 meter away from the charts monoclonally. So I close the left eyes. So she's going to identify the letters from the first line. Okay, so Beauty, can we take it from the first line? Okay. NAUBXY 2 6 97 45 5 7 16 73. Nothing is there. Nothing. The right eye. Let's see. All and they're straight, no broken lines. Okay. Sorry. What about here? Same thing, no broken lines. And here, no broken lines. That's okay. You can have a seat. How many fingers are you seeing here? Close this eye. Look at the nose. We're going to take the subjective refraction, starting from the objective that we've done. Okay, so can we take the chart from the first line? Okay. KG. Okay, go ahead. CSRVH VOLKG RSHCN OCZKN VHGSC SNVKD HOZLC NCKDR ZHCRN. And this you tried. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You tried very, very, very well. So you have 0.6. Okay, so we want to find out the magnification for her distance correction so that she'll be able to carry her distance task comfortably without bumping into things, to be able to read her charts, to be able to read signages as she's going out and all that. So for us to be able to get her distance device, prescription for a distant device, we're going to take it from where she had what she has as her VA, the actual over the desired. So currently, binocularly, her VA it's 0.4 m. We have 0.46, so more like 0.5 m. And then our target is for her to take it to 0.1 m. And 0.5 m over 0.1 m gives us a 4x magnification. So her telescope, we're going to get a telescope of 4x magnification. So we check our devices, what we have in the clinic, what is available, and let's see how this can take her to 0.1 logma on the charts. Okay, so at the end of the day, we're able to make out what she needs to be able to carry her task out efficiently while at work. So she will be needing a spectacle correction with an reading add of +3 diopters, which will make her total reading at +6, and she'll be able to read at a focal length of 16.6. But we're able to test run it, and she was able to read at a focal length of 20 cm. So she's able to read 0.63 m at 20 cm. And with this, she'll be able to carry out her near task comfortably. For her distance correction, with a telescope, Galilean telescope, 4x magnification of Galilean telescope, she'll be able to see 0.18 logma but she has been advised that she can only use it when she's trying to view a distant object while at a stationary position because she cannot move around with it. Only if there's need for her to look at something at distance, then she can bring it out and look at it. But she has made it clear to us that her need and her pressing need at this point is hernia correction so that she can be able to walk very well. So we are going to finally prescribe a reading aid, a spectacle correction, a bifocal with a reading aid of +3 diopters, which she can be able to use to read. And then to work on her computer, she's going to use the distant part of her correction of her glasses. She has been cancelled to change her monitor in her place of work to a bigger monitor, a big screen, so that she can increase her print size. And once she increases her print size, she'll be able to use a distant part of her glasses to work on the computer, while she uses the reading aid to be able to read at 20 cm distance. So with this, even she'll be able to go out with her hobby. Her hobby will not be affected. She'll be able to sing, she'll be able to read, and she'll be able to walk very well and carry out her task in her working place. And she'll be able to use her computer very well. She has also been told some of the limitations. One of them is that the spectacle correction might be a little bit heavy, but with time she'll get used to it. This is just a +3 add. If there's need for her to use a telescope, she has made to understand that she can only use it while standing at a place. She doesn't need to move about with it, just to bring it out and view any distant object she wants to view. And then for her reading aid, for her reading material, she has been cancelled that it's better she reads not moving her head, but moving her prints so that it's easier for her to focus and then maintain the lines on where she's reading and flow very well. Also, she has also been cancelled on the need to come for routine regular checks and then guidance.